that are in the news right now for their potential longevity effects. And they are located in the title of this talk, which is Ivermectin and Fendendazole in Cancer Research and in Longevity. To begin with, again, my name is Dr. Michael Wald, otherwise known as the Blood Detective. You can visit my website at drmichaelwald.com for free content. Just search the blog section or the search bar at the top of the page. And certainly send me your show ideas, criticisms, comments on this show or any other topics at my email, which is info@blooddetective.com. I am a chiropractor, also a board-certified nutritionist, dietitianist, life coach. I do lots of different things. But let's get to the topic. I'll start with a brief disclaimer that this information is for your education. It's not meant as a substitute for sound medical, health, and or nutrition advice. So let's start with ivermectin. I think this drug gained some popularity in the minds of the public during the COVID epidemic. So I'll just begin with its mechanisms of action and how it may work for longevity. So number one, ivermectin binds to what's known as a glutamate gated chloride channel in a parasite or different types of parasitic organisms. And by binding to those channels, it helps to kill parasites. So that's why it's so effective as an antiparasitic medical treatment. And also, ivermectin interacts with another popular drug, which is also available in health food stores, known as GABA, G-A-B-A, gamma aminobutyric acid. So ivermectin interacts with GABA receptors, inhibiting neural transmission in certain organisms, which means it kind of shuts off the nervous system in some of these parasitic organisms and makes them less viable. There are side effects to ivermectin that some people do experience more or less, including nausea, dizziness, itching, and in rare cases, neurological effects such as confusion. Ataxia can also result, which is a motor condition. And look, I see the appeal as an anti-aging doctor myself, where we want to age as well as we can. Not so much in terms of number of years, that would be nice, probably. But most people that I talk to, when I interview my clients about this, they say, Dr. Wald, I don't really care about how long I live. I want to live well. And that's known in the longevity circles as living longer during the non-disability stage of life. And ivermectin might be a potential anti-aging agent. It wouldn't be the only thing I would use, that's for sure. And regarding that, I encourage all of you to look at my other podcast, which is Blueprint versus Blood Detective. These are both longevity approaches. You can find that talk, Blueprint versus Blood Detective, on any podcast platform. Just search Ask the Blood Detective, and also at my website, which is drmichaelwald.com under the blog section. So the potential for ivermectin for longevity and the study and work around this seems to suggest that it has very strong anti-inflammatory effects, and that's really important. Again, most average people now know that most of our diseases, particularly our chronic degenerative diseases, all involve inflammation, a low grade or higher level of chronic inflammation. And studies suggest that ivermectin has anti-inflammatory, antiviral, and cell-killing effects, meaning cancer cell effects, tumor cells killing. And obviously, by reducing inflammation, we might increase lifespan, and we certainly might increase health span. So let's talk about ivermectin and some drug interactions. So first of all, the drug may work synergistically with antibiotics and antimicrobial medications. So it actually might help those medications. It's also shown potential in combination with antiviral drugs and as a stronger or an additional, you might say, immune support. And ivermectin can be taken safely with many different nutritional supplements, but there are some supplements that work well with ivermectin. I'll discuss that in a minute, and some that do not. I cannot cover all of those synergistic and antagonistic reactions here, so you can, if you're interested in knowing those, and I can do an entire show on that, just reach out and let me know. You should know that some of the negative effects of ivermectin are in those people who are on anticoagulant medications like warfarin and aspirin. And the problem with ivermectin and blood thinners, for example, are that together they may amplify the adverse effects. One should also be careful not to take ivermectin with grapefruit juice or grapefruits, because grapefruits have a chemical that can interfere with a very important liver detoxification system that ivermectin depends on, and that can cause adverse reactions. Ivermectin's positive and negative nutritional interactions. So we know that ivermectin combines positively or synergistically with certain antioxidants like quercetin and also the mineral zinc. And by taking quercetin and zinc and ivermectin, you get superior antiviral effects than just ivermectin alone. A negative interaction is that ivermectin can interact adversely with blood thinners, as I've said, along with some sedatives, increasing bleeding risk and drowsiness. So it's important that if you're thinking of taking these medications, you certainly want to speak with your anti-aging doctor about the proper combinations of things. So let's move on to fenbendazole, its medical and longevity potential. So the mechanism of action of fenbendazole is that it inhibits what's known as microtubule formation by binding to beta tubulin. And this disrupts cell division in parasites, helping to kill them off. So fenbendazole is also a potent antiparasitic infection. And its potential in terms of longevity includes anti-cancer effects, possibly by impairing tumor cell growth and also by enhancing the immune response. This is an image of or graphical image of a tumor. It's pretty scary. Fenbendazole drug interactions and potential for longevity also states that the medication fenbendazole particularly impairs the cell growth of tumors, and that is a particular mode of action that is quite specific. So positive interactions of fenbendazole are that it works well with various types of chemotherapy. So if you choose to take this medication and you're also recommended chemotherapy, look to see if there is a positive interaction with your chemotherapy, because oftentimes there is. And fenbendazole also combines very synergistically, which is a good thing, with some nutrients, and two of the top nutrients it works quite well with are vitamin D3 and vitamin B12, particularly the methylated form of B12, or methemoglobin. And that supports overall health by the synergistic reaction. And most common medications do not react with fenbendazole, but you want to check with your prescribing doctor about any adverse or synergistic interactions, and better yet, also ask your pharmacist. So we know that fenbendazole may interact with liver medications, affecting their metabolism. It could interfere with certain antifungal and antibiotic treatments. And high doses of fenbendazole might also impact liver enzymes, causing a rise in liver enzymes, which is a form of hepatitis. So any approach, any longevity approach that includes medication needs a very strong nutrition base. So I would advise anyone considering these medications to seek out the help of a holistically minded physician or doctor that has license to run blood work. Dietitians provide basic information, and as a dietitian, I could not perform laboratory work, but because I'm also a doctor of chiropractic, I can perform laboratory work. You should also know that I went to medical school, I graduated medical school, I earned my MD degree, but I decided not to spend several years in a hospital, because there are plenty of doctors who will do that. I like the longevity work, so here I am. And sometimes we would combine acupuncture and life coaching. There'll always be food recommendations and very exacting nutritional supplements that work synergistically with these medications and not antagonistically. And finally, feel free to reach out to me for a free 15-minute conversation to see if I'm the right practitioner for you. And as I mentioned earlier, send your show ideas and comments to info@blooddetective.com, and check out the free content at drmichaelwald.com. Thanks very much, and I'll see you at the next presentation.